The next chapter is Chapter 10, Environmental and Lifestyle-Related Pathology. This means it's preventable pathology is the underlying message. So the first category we're going to talk about is poisoning and toxins. One that's very common. When you have incomplete combustion of organic material, you have to worry about the release of carbon monoxide. And the sources are obvious, things like combustion engines and automobiles. These could be propane driven. Diesel doesn't make any difference, because if you had complete combustion of organic material, you would get carbon dioxide and water, and this would not be an issue, but unfortunately this is an issue. Home heaters. Remember the furnaces in your houses. If they get a crack in them, you are producing carbon monoxide, and families have known to die in their houses because of malfunctioning heaters leading to large emission of carbon monoxide. Byproducts of any combustion, fires, barbecues. And that's why, for example, as a backpacker, they never tell you to cook in your tent, because if you do, you can die of carbon monoxide poisoning. Cigarette smoke. You'll notice that cigarette smokers, often when they're trying to quit, they can't have enough endurance, or they don't have enough endurance to run, or they're out of breath, because about 10 to 12% of the hemoglobin is bound by carbon monoxide. So they have diminished oxygen carry capacity because of this almost irreversible binding to hemoglobin. So in terms of pathogenesis, it is a odorless and colorless gas. It has a high affinity, almost 200 times the affinity for hemoglobin compared to oxygen. So it's essentially, what is it going to do to the dissociation curve of hemoglobin? It'll shift it to the left, leading to obviously severely diminished delivery of oxygen to vital tissues. And obviously this would be a cause of systemic hypoxia. What are the symptoms that will develop because of this carboxyhemoglobin? And it will depend upon what percentage of the hemoglobin is saturated with carbon monoxide. So 10% or less is going to be asymptomatic, unless you do some type of increased oxygen demand activity like aerobic exercise or running a lap, for example. Then you may find you may be out of breath or have lower endurance. In you and I, we can have up to about 1 or 2% of our hemoglobin bound by carbon monoxide from air pollution, for example. So it depends upon what the environment that you're living in. About 30%, once it's bound to it, can give you a headache or shortness of breath on exertion. 50%, obviously you can have dyspnea at rest, or loss of consciousness, convulsions, and eventually go into coma. And 60%, you've gone from an aerobic metabolic state in the body to an anaerobic, and then you develop a metabolic acidosis, and death is just around the corner. That's why carbon monoxide poisoning is also used by a number of people to try to commit suicide by closing the garage door and allowing the emissions to build up, especially the level of carbon monoxide poisoning. So another important color when you have carboxyhemoglobin, when you see it in acute forms of carbon monoxide poisoning, we call it bright cherry red color. It could be of the skin, the mucosal membranes, and blood, because you have a lot of blood flow through these various structures, and it becomes quite noticeable. Obviously at this point it's probably in the 50 to 60% range when you start noticing it. Obviously if you're a darkly pigmented individual, it would be far more difficult to ascertain that the patient has carboxyhemoglobin as a consequence of carbon monoxide poisoning. What's the treatment? Obviously to remove the source that's emitting the carbon monoxide, and then obviously hyperbaric therapy, where you're going to be giving oxygen to try to dissociate the carbon monoxide from hemoglobin. So hyperbaric oxygen treatment. Another poison that's out there that people are exposed to is mushroom poisoning. Now, people go looking for mushrooms in the wilderness for several reasons. One, they want organic pizza sauce or spaghetti sauce or ravioli. The other reason people like to go out is for a hallucinogenic effect. But the third problem usually arises is they get poisoning instead of the first two that they're looking for. So there's various species of mushrooms out there that have the capacity to cause poisoning. One is called Amanita muscaria. Basically, this will be minor injury to the body where it requires supportive therapy and rarely lethal. But the one that kills or is on the USMLE is Amanita phalloides. Now, Amanita phalloides has an important toxin called amanitin that likes to inhibit an important enzyme is RNA polymerase. And what's an organ, for example, that has a lot of RNA polymerase is the liver. So these patients can go into fulminant necrotic hepatitis and require a liver transplant. It can lead to abdominal pain, vomiting, and diarrhea, and again lead to massive hepatic necrosis, and then leading to coma and death. So the moral of the story is look for mushrooms at your local market, not in the wilderness, because even mycologists who are experts in fungi can screw it up as well. So they can be variable in color, so the best place is your mushrooms in your local supermarket. Another important poison is arsenic. Now, arsenic is a heavy metal. It's the second most common heavy metal poison in the United States. What's number one? We'll talk about this is lead. And arsenic has an illustrious history throughout world history because arsenic has been used by the Chinese as well as Europeans for centuries. Instead of a political recall or coup, what they would do is invite their political opponents or their monarchy or their siblings and then invite them to a party, lace the beverages with arsenic, and then they would be succumbed to the poisoning, and that took care of that. Who's a famous person who died of this, of chronic arsenic poisoning, was Napoleon Bonaparte. And they found large quantities of arsenic in his body because arsenic has a propensity to bind to sulfhydryl groups of proteins. And that's why you can detect it in the hair and nails after being exposed to it. It's also often a common poison that's used by people who marry individuals who want to collect life insurance, where they have their spouses die mysteriously and collect on the life insurance policies. And so it becomes an issue. Arsenic used to be found in rat poison in the United States, but rat poisons were taken off the market that had arsenic because people were using the rat poison to feed their significant others. So what is found in rat poison today is coumadin. So if you're a rat or a mouse that ingests it, you bleed to death. In the acute poisoning of arsenic, it can lead to damage to the stomach and small intestine, leading to a hemorrhagic gastritis, leading to hypovolemic shock. It can lead to comas and seizures in the acute phase. It often is described as having a garlic scent breath. And then chronic poisoning, again, it'll have this constitutional symptoms of malaise, abdominal pain. You can't really understand what's going on with the patient. And it also can lead to peripheral neuropathy and muscle weakness. And it can also lead to dermatologic changes like hyperpigmentation and dermatitis. And because it binds the sulfhydryl groups of proteins, you can actually see, depending upon the interval of time between the poisoning and chronic, what are called me lines. These are transverse bands where the arsenic is now bound to the sulfhydryl groups within the protein in the nails. What are the complications long term? Besides death is going to be carcinogenesis. We think of squamous cell carcinoma of the skin, lung cancer, as well as a rare tumor that we talked about earlier is angiosarcoma of the liver. The most common heavy metal poisoning in the United States or on the USMLE is lead poisoning or plumbism. And the epidemiology is critical because, for example, now in the United States, before you can start elementary school, every child has to have a lead level drawn to make sure that they are not going to have neurologic symptoms, because one of the organ systems that's affected by lead poisoning is the CNS. And we'll often think it affects children, but not always. It depends upon the source of the lead, and the lead is ubiquitous. In every home, anywhere in the world or in the United States, you can find some source of lead, or in your garage. It used to be in lead paint, used to be ubiquitously used in the past, but as long as you don't chew on the paint, like in an old Victorian home, like for example in San Francisco, or older homes on the East Coast or in the South, that if you cover it with latex paint, it's not going to be any issue in terms of causing lead poisoning. Our plumbing used to have a lot of lead in the metal, especially in states like New Jersey, where there's still a large issue in terms of lead leaching out into the water system. Lead is found in faucets, so when you turn on hot water, for example, a little bit of lead is leached out. You can find it in ceramics as well as pots, so if you do a lot of cooking in pots that have lead in there, it can leach out in the food and get lead poisoning. And we used to have leaded gasoline, and that's one of the reasons why lead was removed from gasoline, to diminish the probability of lead poisoning or getting lead into the water table and causing both acute and chronic poisoning. Lead can be found in the glass that you see in crystal glass canters, glasses. If you look at the composition of these, they can have up to 22% of it made of lead. So what are the organs that are crucially sensitive? I mentioned earlier, it can lead to CNS toxicity, lead to lethargy and somnolence, impair cognitive capability, and lead to behavioral problems. So you may have what you think is a person who has hyperactivity, but really has an issue as a consequence of lead poisoning, and can lead to acquired mental retardation after chronic exposure. And it can lead in the acute phase, cerebral edema, and lead to encephalopathy. Another important characteristic of lead, it can affect the peripheral nerves and lead to demyelination. It can lead to what is called wrist or foot drop in this case. It can, if you ingest it, obviously, you can cause abdominal pain or lead colic. It can also go to the kidney and cause acute tubular necrosis or chronic failure as a consequence of exposure to the lead. It has a unique propensity to lead to a microcytic hyperchromatic anemia with basophilic stippling. And as you recall, the most common cause of microcytic hyperchromatic anemia in the United States is iron deficient anemia. And iron deficient anemia does not have basophilic stippling. Remember, basophilic stippling is basically the clumping of cytoplasmic RNA within the red blood cell that's characteristically found in those individuals that have lead poisoning. What lead does, it binds to the various enzymes in porphyrin ring synthesis and blocks it, leading to a microcytic hyperchromatic anemia. Another characteristic clinically that you look for in physical exam is what is called the lead line in the gingivodental line, which is found in the mucosa between the teeth and the gingiva. Give it a grayish color versus the nice pink, well-vascularized mucosa in the oral cavity. It has a propensity to go to the epiphyseal plates and growing bones, and will increase the density that can be assessed by looking at x-rays of those epiphyseal plates. The diagnosis of lead poisoning is based on blood levels. And is there a safe blood level of lead? There is none. So you want to minimize exposure throughout life, especially in the very young. And you can also detect it by looking at increased free erythrocyte protoporphyrin in blood levels. And the treatment, obviously, once you determine that there is lead that the individual is being exposed to, is to find the source and remove it. And you can also use chelating agents to try to remove as much drug that's endogenous within the individual. Another poison that's we have to be concerned about is mercury poisoning. Mercury, remember, thermometers had mercury in it, and as a child, some of us have played with mercury, and it was fun to play with. But one of the things you can get mercury poisoning not just by ingestion, but by touching it, especially if you have a liquid interface. And we'll get to this in a moment. So when you think of mercury, the one organ system that is exquisitely sensitive to it is the CNS. It can lead to neurotoxicity, and it can lead to intention tremors, and dementia and delirium. And then we come to the literature. If you think of Alice in Wonderland, you remember the character Mad as a Hatter. Because if you go back in time, since this was a book that was written in England, there are unique places in England where each city would manufacture a particular unique product. And hats were specifically made in the city north of London called Luton. And when they made these hats, they had a metal brim inside that had high quantities of mercury. So when you sweat, the perspiration would allow the mercury to now be solubilized and now penetrate through your skin, and you became mad as a hatter. So you can find mercury poisoning even in the literature. It also can travel and cause damage to the kidneys, leading to acute tubular necrosis. Obviously, you want to stop the exposure just like lead and chelating drugs. Cyanide poisoning. Cyanide, you say, well, where can I find cyanide? Well, anytime you see anybody burning anything, a cigarette, marijuana, tobacco, no matter what you like to smoke, you will release cyanide. And so cyanide, when it's in high concentrations, you can actually smell the breath is of bitter almond. The important mechanism that cyanide likes to bind to is going to be the enzyme in the mitochondria called cytochrome C oxidase. That's obviously going to lead to a disruption of oxidative phosphorylation, obviously diminishing the ability to make ATP. And again, as I mentioned, it's just a systemic asphyxiant. In your syllabus, there's a table that's illustrated in the slide to demonstrate industrial toxins. One of the important things that anybody can be exposed to is soot. And soot from the combustion of organic material is highly carcinogenic because there are many carcinogens found in soot. And the first epidemiologic study of cancer was done in England in 1776, where they noticed that those who were chimney sweepers would get scrotal cancer. And so how they would get the scrotal cancer is because they wouldn't wash their hands when they went to the bathroom after cleaning a chimney, and what would happen is the soot from their hands would then cover their genitalia, including their scrotal sac, and they had an increased risk for scrotal cancer. So what do they do to prevent this once they figured this was the case is to hand wash before you go to the bathroom. So as clinicians, you always got to wash your hands before you go to the bathroom, and you should wash your hands afterwards. Otherwise, you become a conduit of disease to yourself and to others. Vinyl chloride, we've already talked about. Angiosarcoma of the liver. Uranium and radon gas in minors can lead to lung cancer. Beta-naphthylamine, what you see in dye makers or rubber workers, you worry about urinary bladder cancer. Benzopyrene, we mentioned, we find it in many sources from soot, for example. Burning, incomplete combustion of material will lead to the formation of this particular carcinogen, and you can find it in anything like steel mills, cigarette smoke, any combustible material that you're burning that can lead to increased production of chemical carcinogens, leading to lung cancer, and can circulate and go to the bladder, leading to urinary bladder cancer. Carbon tetrachloride, you think of dry cleaners, and it has a hepatotoxicity, causing liver damage as well as causing acute tubular necrosis. And as you talked in pharmacology about organophosphates, like in farmers or migrant farm workers or anybody who works in the fields that are exposed to pesticides of this classification, as you recall, these are irreversible choline esterase inhibitors.